Hi friends, it's Justin and Connor again, who's become a complete YouTube star. You're probably not able to book him because he's really busy. We've got some hemorrhage control stuff here. We're going to do the hemorrhage control station for the National Registry. The purposes of this video is not to have a conversation about best practices for stopping bleeding or all that goes into that, because there's a lot. We'll talk about that in class, and the fact that the station in and of itself is not meant to be as practical or as realistic. It's meant to have a standard for testing. Can you apply bleeding control? Can you get a tourniquet on? Can you make it work? Do you understand what happens after that? That's the purpose of the video. So if you feel like this is not a full conversation, well, it's not. This is just the National Registry skill sheet for the hemorrhage control station. At that station, you'll have a patient, and you'll have you and the examiner. There'll probably be bandaging supplies there, and there will be a tourniquet there. We're not going to go into the tourniquet. What is it? What kind? How does it work? We'll do all of that in class. This is just a demonstration of the station, okay? So without further ado, I also want to tell you, they tend to tell you the patient is bleeding, arterially speaking, from an anatomical space. Not as simple as right arm, left arm. They use anatomical spaces. So typically the brachial artery is in the antecubital space. You need to know that. The leg, if you have spurting bright red blood from the back of the leg, well, that's the popliteal space. So just remember to go high as possible, as tight as possible, and know which side you're on. If they say right versus left, you know, this is a clue. The patient's arm is visible and available, so that's a clue that we should be on this side. But pay attention to what side they say, and pay attention to what anatomical space they say. Know what antecubital means, know what popliteal means, because they're likely to use that vernacular on the exam. So I don't want you getting hung up on that. Without further ado, let's go to the station, okay? So I got my supplies back here, and I'm going to come up to the station, and my BSI is on, my scene is safe. I'm going to ask the examiner, where is the patient bleeding? And we're going to say the patient is bleeding from the right antecubital space. So that's the front of the elbow space. It's bright red spurting blood. So I'm immediately going to apply bandaging to the bright red spurting blood space and ask the examiner if the bleeding has stopped. They're going to say no. Here's an important part. You can't just walk away and get the tourniquet. You got to have the patient hold the bleeding. Someone's got to keep the bleeding as pressurized and as tamponaded as possible. You want to keep that bleeding from continuing, even if it's just slowing it, not necessarily stopping it. So, sir, press real hard, don't move. Keep that on tight. I'm going to open up my tourniquet. We'll talk later about tourniquet differences and practices. And I'm going to bring the tourniquet around so that I can come towards me with the red tail of the tourniquet. High as possible, as tight as possible. So I'm going to get real tight, bring that around. I'm going to tell the examiner that I would turn this as many times as necessary to stop the bleeding. So I'm going to keep turning until the bleeding quits. So I'm going to keep turning until the bleeding quits, and then I'm going to lock it in. I'm going to ask the examiner, has the bleeding stopped? And they say yes. So then at this time, I'll lock that in. Good practice is to also bring this around so that it doesn't get caught and torn away from the tourniquet. So I'm going to lock that whole thing in right there. And now they're going to advise you that the patient is showing signs of shock. So then I'll treat for shock. I'll get the patient in supine position. If their airway is fine, I'll put them on high flow oxygen via non-rebreather mask at 15 liters per minute, and I'll transport the patient emergent. That's the treatment of shock. High flow oxygen, blankets to protect warmth, and appropriate positioning for the assessment, for the complaint, for the patient's presentation. So supine, 15 liters a minute via non-rebreather. Let's get in the ambulance and get out of here. Ask the examiner if the bleeding is still controlled. They say that it is, and you're done. That's the end of the station. If you have any questions about the station, reach out to me. You have my information, 843-496-0129. And I will be able to answer your questions. These videos are available on the study guide section of Moodle. Thank you very much. Thank you, Connor, for always allowing us to use you as a patient. Okay? Until next time.